Cystoscopy is a medical term for using a telescopic camera to look inside someone's bladder. This can be done under local anaesthetic, or it's often called a flexible cystoscopy, which we do in a clinic room, or it can be done with a general anaesthetic, sometimes called a rigid cystoscopy. This is an excellent procedure for understanding what is inside someone's bladder. We often use it if we're investigating things like blood in the urine or urinary symptoms. Under general anaesthetic, it can also be a very good way of treating problems within the bladder or sampling the tissue in the bladder, taking a biopsy in order to better understand someone's condition. It's very commonly used for treating bladder cancer or for treating bladder stones and other bladder conditions, but is often used to rule out some of those conditions as a check for people who want to make sure their bladder is healthy inside. So flexible cystoscopy under local anaesthetic can be performed in the clinic. It takes probably 4 or 5 minutes for the procedure. We perform it using a local anaesthetic jelly, which is squirted down the urethra, and then the camera is inserted. We use water to fill the bladder so it's nice and stretched out, so we get really good pictures. And with the modern equipment we use, patients can also see an image of the inside of their bladder. We're able to record videos and photographs if that's helpful as well. The main risks of a flexible cystoscopy are that it can be uncomfortable. There's a likelihood of getting some blood in the urine, usually just a small amount in the days after the procedure. The risk of infection is about 1 in 50, so we don't normally give antibiotics, but they can be given if there's a particular concern. And if we find any abnormalities, that may go on to necessitate further tests or treatment for the patients. When it's done under general anaesthetic, the instruments are slightly larger. There can be more incidents of blood in the urine. Usually under general anaesthetic, an antibiotic is given to minimise the risk of infection. And if any procedures are undertaken within the bladder, whether that's taking biopsies or removing growths from within the bladder, there's a small risk of injuring the bladder or the urethra during that procedure and needing further treatment to repair it. The results of any tests will then be discussed with patients later on, and plans made for any further treatments that might be necessary. With the procedure under general anaesthetic, particularly if there's the need to take a biopsy or remove any tissue from within the bladder, other risks might include making a small hole in the wall of the bladder. Much of the time this will heal up by itself. Sometimes it might need a catheter to stay in for a week or two to help the healing process.